1 in 5 Americans know someone
Opioid-related mortality,
with opioid
we've seen a significant
For decades, American communities have been torn apart
over the last 10 years.
New research shows the opioid epidemic has taken an especially deadly toll on new minds. Long-term
It's like losing your best friend. It's losing your soulmate.
In 2023, doctors wrote 125 million prescriptions for opioids. Arkansas, Alabama, Louisiana, and Mississippi reported the highest distribution rates. Public health agencies like the Center for Disease Control and Prevention, the CDC, recommend using opioids for the minimum time at the lowest dose. Stigma and discrimination against those with opioid addiction and mental illness is fiercely influenced by its representation in the media, specifically by the unkind nature of language used in describing individuals struggling with an opioid addiction. Opioids are made from either semi or entirely synthetic sets of chemicals. Similar to that, an opiate is specifically a natural amalgamation that is made from the poppy plant. Semi-synthetic or entirely synthetic opioids such as fentanyl and heroin are made in a lab to mirror the effects of more natural opioids like morphine. Due to their pain-dulling properties, prescription opioids are for the treatment of short-term pain, chronic pain, active cancer treatment, palliative care, and end-of-life care. Opioids don't cure the source of the pain, but they decrease the perception of the pain. Other side effects are drowsiness, confusion, euphoria, nausea, and constipation. Doctors prescribe opioids to people in pain, lessening the pain, and so they continue taking the opioids, which may lead to them spiraling into an addiction.
The stigma of addiction creates a negative perception of the matter for those beginning or heavily involved in struggling with substance abuse. For example, in the media, people with substance use disorders are painted as unhygienic, unkempt, and may look as if they're homeless, when in reality, these people may look similar to others who don't use opioids. The picture painted by social media showcases people who are suffering and in need of help because of their addiction. Because of the false imagery seen across the media, people are unable to see what really happens when someone is struggling with these substances. Anyone could see these images, especially the younger generation. By viewing these images, it could make these younger generations feel like they cannot reach out for help, even if they need it. This is due to the fear that they might be seen as those same people they viewed online. Most children, teens, and adults each utilize some form of social media. According to the National Library of Medicine, the most influential teenage years are between 12 and 15, which is one of the main age groups who utilize social media. Drug use has a heavy impact on teens. The same article reported that teenagers spend an average of 8 hours per day on some sort of social media platform. This results in a lot of exposure to images related to substance use. Social media companies such as Instagram, TikTok, and X utilize the idea of an algorithm to build a personalized experience for the user. These algorithms built for platforms like social media could give someone only one-sided information. The problem with this point of view is that you are only getting the information that you're being fed. The Institute for Internet and the GIST Society informs us that algorithms are learning machines, so they learn how to carry out tasks under various levels of human
Social
oversight.
media further perpetuates a negative light on view on opioid addiction. With the ongoing opioid crisis, social media showcases opioids primarily as an issue of addiction, without giving ways to reach out for help or how to prevent addiction. The way in which the opioid epidemic is shown through social media has fully separated the community into the concepts of good and bad. The media doesn't pay attention to the underlying problems within its own systems, thus ignoring the root of the issue. Online, there are so many opinions and perspectives that are being shared, and the algorithm is pushing the ones that they want teenagers and kids to see. One case that has been in the news for a number of years is with Big Pharma. Big Pharma is the term for companies who produce and work with pharmaceutical companies that are working to get people addicted to prescription opioids. The AMA Journal of Ethics put it like this: over the past 25 years, pharmaceutical companies deceptively promoted opioid use in ways that were often neither safe nor effective, contributing to unprecedented increases in the prescribing opioid use disorder and deaths by overdose. These companies make billions of dollars each year. Some include Johnson & Johnson, Pfizer, Merck, and AbbVie. In attempts to stop these, many of the companies that fall under the Big Pharma name have been sued. Bringing the issue to light would help showcase the issue at hand, but most of the time, these issues with Big Pharma can only make it to newspapers and other types of news sources. When it comes to social media, teenagers are not seeing the issue on social media. By not seeing this issue, teens get the idea that asking for help and reaching out to doctors is not okay.
But as stated before, issues like Big Pharma only make it to newspapers and other types of news sources that the majority of today's youth might not be reading. When it comes to social media, teenagers are not seeing the big issues, the things that are affecting them and the generations to come. Big Pharma and other drug companies may be becoming increasingly untrustworthy. With that being said, and considering social media is one of this generation's main access to that form of information, the media has such a startling influence on today's society. If the important information is hard to access, then misinformation is spread, making people feel insecure about their own issues since they don't see themselves represented.
Some may claim that the media does a good job of portraying opioid addictions. The media can be used as a positive and helpful tool, if used correctly. For instance, with social media, there are pages created across platforms that help spread the word about addiction. An example of this can be seen in Connecticut. The Connecticut Prescription Monitoring and Reporting System, CPMRS, has gotten the word out about their Change the Script RX message. The message helps get the word out about CPMRS. The message is spread through social media, newspaper ads, and posters to display the issue at hand. Because Gen Z uses online media to get most of their information, they tend to only get one perspective.
News coverage of opioid addiction is clearly biased. A CNN news article quotes Dr. Sivalabalaji Kaliamurthy. He describes the kids who tend to seek treatment for opioid addictions. Quote, "The kids who are presenting to treatment," end quote. The word presenting as an introductory phase may lead the reader to create the assumption that the kids seeking treatment are reporting for the duty of getting clean. Kaliamurthy continues, quote, "These are the kids who are motivated to stop. They predominantly identify as Hispanic in ethnicity," end quote. The news is explaining the demographics using the word identity. This word means that what you believe, it is how you associate yourself. By saying that this is how they identify, the news pushes the initially unbiased reader to create a bias and to begin feeling disconnected from the people they're referring to, since their identity feels questioned. Specifically, in regards to naloxone, an opioid overdose reversal agent, quote, "Everyone should have it. Naloxone is not a treatment. It's more of an antidote. It reverses opioid overdoses, and the person who has the opioid overdose is never the one who's going to use it somewhere in the community," end quote. This opinion of those addicted to opioids is dangerous in the community, and the stigma is common amongst it. CNN says that, as drug overdose deaths reach record levels in the United States, evidence-based treatments for substance use remain significantly underutilized, a new study found. This quote comes from a news article that is based on a study. It is written in such a way that does not offer help for those who may need it, but rather accuses them of not using the resources provided, even though they are struggling with the disease that may inhibit their critical thinking. When someone is addicted to opioids, it is specifically harder for them to see how it is affecting them negatively, since they feel worse when they stop due to withdrawal and want to continue using to get that high, that relieved feeling again. With this in mind, it is crucial to dig deeper into the stories the news is putting out there, as well as their biased language against those struggling with addiction.
In today's society, television influences the stigma surrounding opioids and substance abuse. People who suffer from opioid addiction are showcased on television as people who are struggling and unable to ask for help. Shows such as Law & Order, The Simpsons, and Shameless showcase opioids and other substances as a reoccurring plot. In the show, substances are a major plot point, with multiple characters being seen using substances throughout the show's run. This creates stigma around addiction, which creates the idea that recovery and addiction work the same for everyone. People may struggle to go get treatment or admit that they have a problem. In order to understand more of television's influence, we must look at the facts. The American Addiction Center conducted research that analyzed over 70,000 television scripts in order to see if they mentioned or included any substance-related plotlines. Through their research, it found that 41% of substance plotlines were found in comedy shows, most commonly opium and marijuana. But other drugs, such as heroin, are used in crime or drama shows. Television influences the viewer through relatable characters and storylines, how one sees themselves and others. In television, someone struggling with a substance issue can be displayed as something to be ashamed of. But, on the contrary, certain substances, such as alcohols, can be shown as something fun and normal and not showcasing the real issues with the substance. As addiction specialist Corey Waller states, "Please stop portraying someone who's in recovery from addiction as having a weakness inherently. And on the opposite side of that, don't portray people who decide not to use drugs as lame.
In short, stigma and discrimination against those with opioid addiction and mental illness is fiercely influenced by its representation in the media, specifically with the harsh language used in describing individuals struggling with one or both of these afflictions. Through various algorithms, posts, and videos across social media, the front page news, and shows on television, there are many examples of how stigma of opioid addiction affects mental and physical health. This important issue deserves more light to be shed upon it, and we hope to use this documentary to illuminate the issues in our society and the way that issues such as this are portrayed.